tips for coping with anxiety in a clinical exam.
One look and I breathe.
Imagine you're in a wound care exam and you start to feel nervous. Your hands start to shake uncontrollably. Your voice starts to tremble. You start to sweat. And then you become even more nervous. So you try to compensate by limiting your movements and speaking less. And because of this, you start making even more mistakes. My name is Tisha Vaughn, former nursing student. I experienced all of that during my clinical examinations. I also see it often with my students in clinical examinations. So here are my best tips for coping with anxiety in a clinical exam. The first thing that I need you to do is to accept that you're anxious. Accept that you're nervous. One of the responses that I observe is that students tend to say, I don't know why I'm shaking. Why am I shaking? As if to kind of create a disconnection between what they're feeling and what we're seeing. So you need to accept that you're nervous and also tell yourself that it's normal. It's a normal reaction. Nervousness means that you actually care. You're demonstrating that you actually care. It doesn't even indicate a lack of confidence. Nope. Contrary to popular beliefs. If you're nervous, it simply means that you care, right? So it's okay. It's okay to be nervous. So the first thing that you need to do is to accept that you're nervous and it's normal. You could even say to yourself, I'm nervous. But that is okay. That is normal. The second thing that you can do is quick deep breathing or reverse breathing. So we tend to inhale but exhale rapidly. You don't want to do that. You want to inhale and exhale even longer than your inhalation. This helps to regulate your nervous system and get you out of fight or flight response. Try it. My third tip is called task chunking, which is focusing on one step at a time. You don't want to be thinking about the entire procedure. Sometimes that's what amplifies the anxiety. So think about what you're doing now and what you need to do next in terms of what you do after you complete what you're doing now. So, for example, if you are doing a wound care procedure, you know that you need to do patient education and assessment. So, just focus on that. Go to the patient, identify the patient, and tell them about the procedure, and then get consent to perform an assessment. When you finish with that section, then you think about what you need to do next. Then you do that. Then you think about what you need to do next. Then you do that. It's called task chunking and it prevents you from getting overly anxious by thinking about the entire procedure. Have you ever heard about grounding techniques? Sometimes when you're anxious, you can't think straight. Like you're just standing there, there's really nothing on your mind, at least nothing that comes to focus. So, in those moments, you can try to ground yourself, bring yourself back to the present so that you can focus. Pressing your feet into the ground. If, for example, you're not wearing sterile gloves, you can touch your hand and kind of squeeze it, hold yourself, kind of squeeze, maybe even pinch yourself. Anything to get back into the present. So, utilize grounding techniques. So try these and let me know if they help, if they work for you, if you've tried them before. Let me know what has worked for you in the comments. All the best.